Level 1, no card. Chest pain, hour 1. You sit in the parking lot. The ER sign is on. You haven't gone in. You're doing the math. $11,000 maybe. You've seen the bills, 16 for kidney stones. 2 years ago, you wait 20 more minutes. You're 34. Your jaw is tight. You decide. Another hour. If it's still bad, you go in. It is still bad. You walk into intake. They hand you a clipboard. The box for insurance is empty. You leave it empty. The woman at the desk asks if you want charity care. You say yes. She hands you another form. 8 pages. The doctor sees you. 9 minutes. EKG. Probably acid reflux. Follow up with a cardiologist. 72 hours. You will not. A cardiologist is $400 cash. The follow-up tests are more. 6 weeks later. The bill arrives. $11,847. Itemized. Tylenol, $64. EKG, $3,000. The facility fee for walking through the door, $2,400. You apply for charity care. They reduce it to $4,000. The $4,000 goes to collections. The penalty for not having coverage is that you stop seeking care. Level 2, the state card. Your income dropped last year. You qualify now. You have a card. The card says coverage. Coverage says primary care. You start calling. The first 3 offices don't accept Medicaid. The 4th does. The 4th has a waiting list. 87 days. You ask if anything is sooner. They say no. You take the appointment. You write it on your calendar, February 16th. Today is November 21st. The day comes. You drive 43 minutes. The clinic is a converted strip mall. The waiting room is half empty. You wait an hour past your appointment time. The doctor sees you. 11 minutes. He is good. He looks tired. He orders an MRI. Pre-authorization takes 3 weeks. The MRI is scheduled 6 weeks after that. The closest in-network machine is in another town. You drive there. You get the scan. The results come back. They want a second opinion. The second opinion requires another referral. The referral takes 4 weeks. 6 months after the first appointment, you have a diagnosis. Free isn't free. It's slow. Level 3, the $400 premium. You bought it on the marketplace. The penalty for not having it felt worse than the cost. $412 a month. Deductible, $7,500. You have coverage now. You can't afford to use it. The covered doctor visit is $180. You owe all of it. You haven't hit the deductible. You won't hit the deductible. You haven't hit it any year of the last 3. Your daughter has an ear infection. You take her to urgent care. Urgent care is in network. The doctor who saw her was not. He was a contractor. Insurance covers the facility. Insurance does not cover the doctor. The bill is $4,200. You appeal. The appeal goes to a department. 6 weeks. Denied. You appeal again. Denied again. You set up a payment plan. $120 a month. 35 months. Coverage and care are different words. Level 4, the employer plan. You started a real job. HR onboarding. A slide titled Health Benefits. You pick the middle option. $140 a month. The employer covers the rest. Deductible, $1,500. Specialist copay, $60. You can go to the doctor now. Without dread, you go. There's a thing on your back. The primary care physician sends you to a dermatologist. The dermatologist takes 32 days. The dermatologist removes the thing, sends it for biopsy. Pre-authorization is required. Pre-authorization is denied. Your doctor's office calls, faxes, spends 4 hours on the phone over 6 weeks to get approved the procedure your doctor already did. You sit in the parking lot after the follow-up. You have insurance, you have a job, you have a card. Someone is still fighting your insurance for you full time. in the back room of a strip mall office, because that is the only way care gets paid for. At the silver level, the bills drop. The phone calls don't. Level 5. The company that wants to keep you. You change jobs. The new employer has a gold plan. $60 a month. Deductible, $500. Specialist copay, $20. Separate dental. Separate vision. Mental health without a referral. You pick your doctor. You pick your specialist. You see them next week, not next quarter. The MRI is approved before you leave the office. The bill arrives. You read it once. It is correct. You pay it. You move on. The first time it happens, you almost don't notice. You expected to fight. You expected to call. You expected to appeal. You don't have to. You spent the last decade arguing with phone trees. Now you spend that hour at the gym. Gold is where the system stops fighting you. Level 6. The executive plan. Tech, finance, law. The plan covers you. The plan covers your spouse. The plan covers your kids. Premium is pre-tax. Your employer pays so much you don't bother to look at the number. Deductible, 0. Specialist copay, 0. Hospital stay, 0. Brand name prescription, $15. International coverage included. Your appendix bursts on a Wednesday. You go to the best hospital in the city. They put you in a private room. You stay 3 nights. You pay 0. The bill exists. The bill is $68,000. You never see it. You forget what it feels like to read a medical bill. You forget what it feels like to dread the mail. At Platinum, you stop reading the bills. You stop knowing they exist. Level 7, the retainer. Your job plan is still in place. On top of that, you pay $300 a month. 600 members. Your doctor's name is Sarah. Sarah's cell phone number is in your contacts. Something is wrong. You text her. She texts back within an hour. Something is really wrong. She sees you that day. Not in a waiting room. In her office. A clean office. No fluorescent lighting. The appointment is 45 minutes. The conversation is unhurried. She knows your wife's name. She knows you sprained your ankle in January. She set the splint herself. She knows your blood work without opening the file. You no longer wait 3 weeks for a specialist. Sarah calls the specialist. The specialist sees you next week. You stop being someone the system processes. You start being someone Sarah knows. Concierge is when your doctor becomes a person you know. Level 8. The membership with no menu. $40,000 a year. Not through insurance. A private invoice. From a practice that does not advertise. The practice does not have a website. You are referred by someone who was referred by someone. 50 members. 3 doctors. A nutritionist. A physical therapist on staff. A private MRI machine in the basement. You are sick. A doctor comes to your home. You travel. A doctor is on call in whatever time zone you are in. You need surgery. The surgeon is the surgeon your doctor would send a family member to. You need a hospital. The hospital makes a room ready. You have never sat in a waiting room. You have never filled out a clipboard. You are admitted. There is a hallway the public does not see. Hardwood floors. The nurse is assigned to you, and only you. The food comes from a kitchen that does not serve the rest of the building. The chief of medicine knows you by name. He has dinner with the founder of the practice once a quarter. The founder has dinner with you once a year. At this level, you don't have a doctor. You don't have insurance. You have a relationship. Somewhere right now, a man sits in a parking lot. He is 34. He has been having chest pain for an hour. He is doing the math. He is doing the math on whether the chest pain is bad enough to be worth $11,000. Somewhere else, a man walks through a hallway he is not allowed to photograph. He is wearing a hospital gown. The hallway has hardwood floors. The nurse who is assigned to him and only him holds the door. It is the same hospital. The hallway with hardwood floors and the hallway with linoleum start at the same loading dock. They were built in the same year. The chief of medicine works in both. The man in the parking lot and the man on the hardwood floor will be treated by doctors trained at the same medical school. The hospital does not change at every level. The hospital reveals what it always was. The chest pain is real. The bill is real. The hallway you walk through is the only thing that changes. He thinks this is about the number on his card. It is not. It is about what the number does to the distance between a person and the help they need. The doors open every morning. The hospital takes whoever shows up. It always starts there. It always will.